Invite everyone to, if they want to ask a question, to let me know. We will have statements from the ministers followed by questions. I'm told that they have until 2 o'clock. So if everyone can keep questions and answers and statements short, we'll get as much territory covered as possible. If those in the room, raise your hand. This is going to be like the National Press Theatre because, and I'm explaining that simply because this is the largest number of people I think we've had in months, if not for a couple of years, in person covering the press conference. So in room, raise your hand. If you are on Zoom, use the raised hand function and you will be able to join the queue. Ministers?
So thank you, Elizabeth, et bonjour tout le monde. Good afternoon. Today I'm joined by my colleagues, the Minister of Transport, Omar Al-Gabra, the Minister of Health, Jean-Yves Duclos, and the President of the Treasury Board, Mona Fortier. Our top priority continues to be the health and safety of all Canadians, and our commitment to work together with provinces and territories to keep Canadians safe remains unchanged. As the warmer weather arrives, we know that across the country, Canadians are looking forward to seeing friends and family and enjoying the outdoors. Notre gouvernement a mis en œuvre des mesures importantes afin de sécuriser nos frontières et assurer la sécurité des Canadiens. Ces mesures ont été efficaces, mais elles n'étaient jamais censées d'être permanentes. Aujourd'hui, nous pouvons annoncer des ajustements à nos mesures sanitaires parce que les Canadiens se sont mobilisés pour se protéger mutuellement et ont suivi les conseils de la santé publique. Mais nous devons nous assurer d'être prêts pour un retour potentiel du virus à l'automne et notre meilleure protection contre la COVID-19 demeure la vaccination. Si vous n'avez pas encore reçu votre première dose de vaccin ou votre dose de rappel, je vous encourage fortement à aller les chercher. Today's announcement is possible because Canadians have stepped up to protect each other. We are now able to adjust our policy because we have followed consistently the best advice from public health authorities. But we need to make sure we are ready for the fall, and our best protection against COVID-19 is being properly vaccinated. If you haven't gotten your vaccines or your booster yet, I encourage you to do so. I know that Canadians may wonder, is this too fast or is this too slow? It has been very tough for Canadians these past 2 years. Our job as a national government has always been to keep Canadians safe. If the situation takes a turn for the worse, we are prepared to bring back the policies necessary to protect Canadians. We don't regret at all being cautious when it comes to a virus that has tragically killed tens of thousands of Canadians and millions of people around the world. Acting prudently has saved lives, and we will always continue to be cautious. Nous ne regrettons pas du tout d'avoir agi prudemment devant un virus qui a tragiquement coûté la vie à des milliers de Canadiens. This announcement is not about shortening wait times that are currently being experienced at some of Canada's airports. As you know, these wait times are mainly caused by staffing shortages. The adjustments we're making today are based on science, and they will not have an impact immediately on these airport delays. We remain committed to reducing the wait times at Canada's airport. We have already taken a number of steps to improve this situation, and my colleague, the Transport Minister, will have more to say in the coming moments. Thanks to Canadians, we are able to make today's announcement. And to share what precise next steps are to come, I'd like to invite my colleague, the Minister of Transport, to say a few words. Omar.
Thank you, Dominic. Hello, everyone. Bonjour à tous. COVID-19 and its threat to our public health and our economy has caused governments around the world and in Canada to take extraordinary measures to protect their citizens. Our government has made a solemn commitment to Canadians to be prudent and focus on doing the right thing, guided by science and expert advice. Our approach to protecting Canadians has worked. Canada has one of the highest vaccination rates in the world, with one of the lowest death rates in the world, and is also experiencing one of the fastest economic recoveries. We've seen how our measures have slowed down several COVID peaks and has given our healthcare system early warnings to adjust and respond. As the COVID situation evolves and as we learn more about this virus, we have been adjusting our measures. Many of these measures have been lifted. And it's clear that the COVID situation is not the same now as it was last fall when we implemented the vaccine mandate for travelers and transport workers. La situation de la COVID-19 a évolué depuis l'automne dernier.
Since last fall.
And this is thanks to the millions of Canadians who rolled up their sleeves and got vaccinated. That's why today's announcement is possible. And I'm pleased to announce that on June 20th, our government will suspend the requirement to be vaccinated in order to board a plane or train in Canada. Le 20 juin, notre gouvernement suspendra l'obligation de se faire vacciner pour monter à bord d'un avion ou d'un train au Canada. Employers in the federally regulated transportation sector will also no longer need to have vaccination requirement for their employees. The suspension of the vaccine mandate was informed by key indicators, including the epidemiological situation and modeling, vaccine science, and high levels of vaccination against COVID-19 in Canada. As for travelers coming to Canada by air, land, and marine, there are no changes. Il n'y a pas de changement pour les voyageurs qui entrent au Canada. All travelers entering Canada must continue to follow all entry requirements, including vaccination and using ArriveCan. As for cruise ships, vaccination for passengers and crew will remain in place. This decision is based on the unique nature of cruise ship travel, including the fact that passengers are in close contact with each other for an extended periods of time. Also, travelers on federally regulated planes and trains still need to wear a mask. Les voyageurs doivent continuer de porter un masque dans les avions et les trains. Masks are an effective way of reducing transmission, especially in areas with restricted space, such as onboard planes, trains, or cruise ships. Our government will always continue to evaluate measures and will not hesitate to make additional adjustments based on the latest public health advice and science. It's also important to note that while travelers will be able to board a plane without having to verify their vaccination status, international travelers need to verify public health requirements imposed by the country they want to visit. Many countries around the world, including the US, continue to require a proof of vaccination upon entering their country. I want to thank all the travelers who've been vaccinated to protect themselves and others, as well as the transport workers who are working tirelessly to ensure the recovery of the sector. Thank you, everyone. Merci. And now I'd like to give the floor to Minister Fortier.
Thank you. Merci, Minister Alghabra.
J'aimerais tout d'abord commencer par reconnaître que je vous adresse depuis mon salon ici à Ottawa-Vanier sur le territoire traditionnel non cédé de la nation algonquine-Anishinaabe. La vaccination a été et demeure le moyen le plus efficace de prévenir les maladies graves causées par la COVID-19. Et dès le début de la pandémie, nous nous sommes engagés auprès des Canadiennes et des Canadiens à protéger leur santé et leur sécurité. Nous avons mis en place des mesures pour protéger les travailleurs et nos communautés. Et c'est pourquoi, en octobre dernier, le gouvernement a mis en œuvre la politique de vaccination contre la COVID-19 pour l'administration publique centrale, y compris la GRC. As the employer of the federal public service, the government has a responsibility to ensure public service servants can work safely. And the policy has done what it was meant to do. It helped make federal work sites, as well as the communities where public servants live and work, safer. And it provided a safer environment for Canadians accessing government services in person, including for more vulnerable members of our communities. Public servants understand the importance of keeping themselves and others safe, which is why close to 99% of them stepped up and got vaccinated. Public service servants were not alone in rolling up their sleeves. D'un bout à l'autre du pays, les Canadiennes et les Canadiens ont fait leur part. Ils ont pris les devants pour se protéger et protéger les personnes qui les entourent. Et maintenant, les taux d'hospitalisation et les cas de maladies graves causés par la COVID-19 sont en baisse dans tout le pays. Aujourd'hui, avec des taux d'immunité en hausse et un taux de vaccination parmi les plus élevés au monde, la situation de la santé publique au Canada s'est nettement améliorée. Et c'est pourquoi le gouvernement suspend l'obligation de vaccination pour les fonctionnaires à compter du 20 juin 2022. As of that date, employees of the core public administration, including the RCMP, will no longer be required to be vaccinated against COVID-19 as a condition of employment. Employees who are on administrative leave without pay as a result of the vaccination policy will be contacted by their managers to resume regular duties with pay, and the bargaining agents have been informed. Similarly, we expect other vaccine requirements put in place for employees of separate agencies, Crown corporations, governor and council appointments, and contractors to also be suspended. And I want to reiterate that vaccines continue to provide strong protection against serious illness. All Canadians should keep their vaccinations up to date to keep that protection as high as possible. Et en conclusion, la politique du gouvernement du Canada en matière de vaccination a contribué à faire en sorte que les fonctionnaires puissent travailler dans un environnement sain et sécuritaire, que ce soit dans un bureau, un centre de service, à la frontière ou à la maison. La situation a évolué, tout comme notre réponse, et la suspension de la politique reflète le fait que nous avons pris des mesures responsables pour gérer la pandémie et par conséquent, nous nous trouvons maintenant dans une bien meilleure situation. Mais soyons clairs, la pandémie n'est pas encore terminée. Vigilance remains essential to protect not only our own health, but our healthcare system and our economy. Again, this means keeping up to date with our vaccinations, and it also means being ready to adjust our approach. Et permettez-moi de réitérer ce que je viens de dire en français. La vigilance demeure essentielle pour protéger non seulement notre propre santé, mais aussi notre système de santé et notre économie. Et encore une fois, cela signifie que nous devons mettre à jour nos vaccinations et être prêts à adapter notre approche. The government will continue to closely monitor domestic and international scientific evidence to assess the need for appropriate public health measures, including a reintroduction of vaccine mandates if necessary. Et comme nous le faisons depuis le début,
And
nous
as we've done from
continuerons
the
à
start, we
protéger
will
les
continue to
Canadiennes,
protect
les
Canadians
Canadiens et le Canada.
and Canada.
C'est notre engagement
That is
et
our
notre plus
commitment
grande
and our
priorité.
greatest priority.
Thank you. Merci. Et je cède maintenant la parole au ministre Duclos.
Now I'd hand over the floor to Minister Duclos.
Merci, Mona, et bonjour à
Thank you,
tous
Mona.
et à toutes.
Welcome, everyone.
J'ai le plaisir, moi aussi, d'être
It's a
accompagné
pleasure
aujourd'hui
for
par
me
mes
also
collègues
to be
ministres,
here
le
with my
ministre
colleagues,
Leblanc,
Ministers
le ministre
Leblanc,
Algabra et la ministre
Algabra
Fortier, bien
and
que
Fortier,
virtuellement,
although virtually,
pour cette importante
for this
annonce.
important
I
announcement
would like to
today.
begin by recognizing the enormous strides we have made since the beginning of this pandemic. Our government's response has always been informed by evolving science, research, prudence, and expert public health advice to help make decisions that serve to protect people everywhere in Canada. Following a successful vaccination campaign supported by proactive vaccine procurements and collaboration at all levels of government, 32 million eligible people in Canada have now received a primary series of vaccination against COVID-19. La science est en constante évolution et chaque jour, nous en apprenons plus sur le virus. Et la science est claire. La vaccination demeure l'un des moyens les plus efficaces de protéger nos familles et nos communautés et de nous protéger nous-mêmes contre la COVID-19. Nous savons maintenant aussi que la vaccination peut contribuer à réduire le risque de développer ce qu'on appelle le syndrome post-COVID-19, aussi appelé la COVID longue, en cas d'infection. Si la vaccination demeure essentielle, le variant Omicron nous a toutefois démontré que 2 doses ne suffisent, car avec le temps, l'immunité acquise grâce au vaccin 2 doses actuelles s'amenuise. Dans ce contexte, il est donc essentiel que nous comprenions tous et toutes l'importance de suivre les recommandations des autorités de santé publique de mettre à jour notre statut vaccinal. En clair, cela veut dire que si vous êtes admissible à une 3e ou même une 4e dose en vertu des recommandations des autorités de santé publique, vous devriez la recevoir dès que possible. Il s'agit de la meilleure façon d'éviter de développer une forme grave de la maladie, d'être hospitalisé ou d'en mourir, et une très bonne façon aussi de réduire les infections et la transmission. Il s'agit aussi de la meilleure façon de protéger nos travailleurs de la santé qui sont sous un énorme fardeau et de protéger aussi les plus vulnérables parmi nous. Though vaccination remains absolutely essential, the Omicron variant has shown us that 2 doses are no longer enough because the immunity acquired through 2 doses varies and wanes over time. In this context, it is therefore essential that all Canadians understand the importance of following the recommendations of public health authorities and stay up to date with their vaccination. In simple terms, this means that if you are eligible for a 3rd or even a 4th dose under the recommendations of public health officials, you should receive it as soon as possible. This is the best way to avoid developing a serious form of COVID-19, being hospitalized or dying from it. It's also the best way to reduce the spread of COVID-19 and the incidence of long COVID. It's also the best way to protect our healthcare workers and the most vulnerable among us. As mentioned by my colleagues, after reviewing the latest scientific evidence, evolving COVID-19 epidemiology globally and in Canada, vaccination coverage rates, and listening to the advice of public health officials and experts, we have decided to suspend mandatory vaccination for domestic travelers, transportation workers, and federal employees. The context has changed in that we now benefit from better levels of immunity from both vaccination and infection, the wider availability of antiviral drugs, and lower and decreasing hospitalization rates. Canada is now better equipped to effectively manage the COVID-19 pandemic and reduce pressure on our healthcare workers. As I have said, because of the immense value of maintaining individual and collective immunity, both in terms of protecting our healthcare system and our economy, the Government of Canada recommends that everyone in Canada continue to protect themselves and their loved ones by staying up to date with COVID-19 vaccines, which includes a third dose for all adults. While the suspension of vaccine mandates reflects an improved public health situation in Canada, the COVID-19 virus continues to evolve rapidly and circulate in Canada and globally. Given this context, current vaccination requirements and other measures at the border entry will remain in effect to reduce the potential impact of international travel on our healthcare system and workers, and track the potential introduction of new variants of concern. As the COVID-19 situation evolves and as our country prepares itself for whatever may come our way later and in the fall, we will continue to evaluate new evidence to determine the best way to reduce the burden of COVID-19 in our communities and protect our healthcare workers and patients. Avant de conclure, j'aimerais rappeler à tous et à toutes que la COVID-19 est toujours une réalité parmi nous. Le gouvernement du Canada continuera de travailler en étroite collaboration avec toutes les provinces et tous les territoires pour faire en sorte que toutes les personnes admissibles puissent recevoir leur dose de rappel et être ainsi à jour dans leur vaccination. Again, let me be very clear. Vaccination, combined with individual public health measures, continues to be the best way to protect ourselves, our loved ones, and our economy as we return to the activities and social interactions we have so dearly missed over the past 2 years. Merci. Thank you.
Thank you very much, Minister. We will now go to questions. Everyone gets one question, one follow-up. If everyone can try to keep the questions and the answers short, because we only have 15 or 18 minutes left out of the time we are told that you have to leave for question period. So, and the more people know, the better the reporting. First question, Raymond Giroux, TVA. Filion, sorry.
Le masque ne sera plus obligatoire dans les transports en commun presque partout au Canada dans une question de jours. Pourquoi le garder obligatoire dans les trains et les avions?
Parce que, en fait, c'est une excellente question. La ministre, la ministre en chef de la Santé publique, Mme Tam, le Dr Tam, l'a répété vendredi dernier, c'est qu'il s'agit, selon la santé publique, d'une mesure à la fois efficace et peu coûteuse qui s'ajoute aux autres mesures de santé publique qui servent à protéger les gens et les travailleurs dans les environnements où l'espace est restreint et les contacts sont étroits.
Et pourquoi garder Arrive Can? Beaucoup de gens s'en sont plaints ces derniers mois. Pourquoi ça demeure en vigueur et est-ce que c'est là pour toujours, Arrive Can?
Let me take a stab at this question. And first, let me talk about masks. Again, as Minister Duclos has said, the evidence is clear that mask is an effective layer of protection. And given how a minor inconvenience it is and the benefit that it poses to not only the passengers, but the people sitting next to them, thinking of vulnerable individuals, immune compromise, I think it's a small, minor inconvenience to ask of travelers who are sitting together in a small, tight, enclosed place. About ArriveCan. ArriveCan is a tool, as I stated in my remarks, we are maintaining a vaccine requirement for international travelers who are arriving to Canada. And ArriveCan is a very helpful tool to ensure that arriving travelers have the required vaccination certificate. We are working with CBSA, with Public Health Agency of Canada to ensure that we increase awareness about ArriveCan, that we increase compliance with ArriveCan, that we reduce numbers of questions that are asked to streamline. So we're working on efficiencies to ensure that ArriveCan is less of a source of complaint. However, it continues to be a meaningful tool to verify the vaccination status of travelers who are arriving into our borders.
David Cochrane, CBC.
First question is for Minister Fortier. This is a suspension of the vaccine requirement for public sector workers. So you say the ones who have been suspended without pay will be allowed to come back to work. But should COVID conditions worsen in the fall and you have to bring back the vaccine mandate for the public service, could they go through an unpaid suspension all over again if there's no change in their status?
Well, first, thank you for your question. And as you know, public servants that did not attest having vaccination that were leave without pay. Currently, they will be able to come back to work as we are suspending. If we go back in the fall or at some point with the mandates, we will go back to the policy that we had in place. I think that is something we have to make sure to focus on the fact that public servants stepped up in this current vaccine mandate. Up to or close to 99% of the public servants attested having both vaccines. And we have to commend public service of stepping up for that. Thank you.
A follow-up question for Mr. Alghabra. What does this mean for cross-border truckers who certainly made their views on all of this well-known earlier this year? Does this in any way affect the status of the people who occupied the downtown of the city core?
David, let me be clear, as I've been trying to clarify this for Canadians throughout this, is that truckers have actually also stepped up. The vast majority of truckers have gotten vaccinated. And we saw that ever since the introduction of vaccine mandate at the border, that our trucking volume at the border, not only was it not impacted, but we've been seeing increases. What that tells me is that truckers have stepped up and done their part to protect themselves, their families, and the sector. And we're also seeing an equivalent measure at the U.S. border. So we know that this is a reciprocal a measure that the U.S. expects of truckers who are crossing the borders, and Canada has the same reciprocal measures. It continues to be an important tool to ensure that we protect Canada against importation of the virus. Having said that, we will constantly assess our measures as we've demonstrated in the past. But I'll tell you, truckers are stepping up. They've continued to provide service for Canadians and deliver the products that Canadians need.
Kevin Carmichael, CTV.
Sorry, Kevin Gallagher here with CTV.
My apologies. This is the second time I've done this.
You're very forgiven, no problem. I think I want to move on right away to right now, if more Canadians who are unvaccinated can now travel in airports like Pearson that are already clogged, what's the plan to deal with the expected increase in travel of unvaccinated Canadians?
Kevin, the issue at airports is an important issue for our government. We have been acting and working collaboratively with airports, with airlines, to ensure that we have increased efficiencies at our airports. We're seeing, as you've heard me say this before, and the facts prove that point, similar phenomena at airports around the world, because we're seeing surge in demand that the capacities of airport are struggling to keep up with. Having said that, we have put a lot of measures in place. We've increased resources of CATSA significantly, CBSA. We've suspended and are going to be lifting random testing at airports, off airports. We have streamlined some processes, including ArriveCan, as I mentioned earlier. We are regularly speaking to airlines and airports. And by the way, airlines are struggling as well with resources. We continue to encourage them to do as much as they can, just like the government is doing. We're adding resources. We're seeing airports need to add more resources, but there is a plan. Measures have been in place, and regular discussions on a daily basis are taking place to ensure. And the data, by the way, proves it. The last couple of weeks, we're seeing significant improvements in delay data, whether for outbound travel or inbound travelers, but I know we need to do more.
Is there specific data that you can mention that leads to today's decision? Why is the hospitalization rates, COVID rates, and other data that you've looked at to make this decision today, what's different about today and June 20th that could not have been done a month ago?
I'll ask Minister Duclos as well to add his own comments, but I'll tell you, this decision today took a lot of discussions and consultations. So the decision today is not based on something that we woke up yesterday or this morning and decided to do. We've done our homework. This is what Canadians expect us to do. They've seen us focus on their health and safety, and that every time we've put in place a measure or lifted a measure, it's done guided by science with the aim of protecting the health and safety of Canadians. So what got us today was a period of discussions, of consultations, of looking at the big picture, of preparing ourselves for a potential wave in the fall, but the current situation today. So we had to look at all the options and all the data that we have, and after a thoughtful, deliberate, prudent discussions, we've reached this decision. So it's what Canadians expect us to do. We will always err on the side of public health and safety.
I would add that the key word today is transition. And Dr. Tam spoke to that just last Friday. She spoke clearly about the need to transition. We've done extremely well in Canada until now. We had, as we all know, we've had a very large two-dose rate in Canada, which has led to one of the lowest death rates in the world, of which we can be very proud. Obviously, that comes with lower numbers of hospitalizations, smaller economic costs than we would have had otherwise. Dr. Tam also signaled that in the 5 first months of this year, we have had as many deaths and hospitalizations as in the entire year of 2021. So that decision took the time it needed to be taken so that we could keep protecting the health and safety of Canadians. COVID-19 is still with us. Fortunately, in the last few weeks, as we were hoping, the epidemiology has improved. The number of hospitalizations, cases, and deaths has fallen. And experts tell us that we should expect the next few weeks in the summertime, for obvious reasons, to be relatively good in terms of COVID-19, like the last 2 summers have been also better than around the two summers. What we also know from Dr. Tan and every other expert on COVID-19 is that although 2 doses still protects significantly well against severe disease and death, 2 doses are not enough now to protect against infection and transmission. And that is why we are transitioning now to an up-to-date vaccination definition of what it means to be adequately protected against COVID-19. Fully protected with 2 doses doesn't work anymore. Dr. Tam said that last Friday. It's now up-to-date vaccination that needs to be used when you talk about what Canadians should do, what we should expect of Canadians, and what this government should be expected to do in the future. As we do that, we are going to take advantage in the next few weeks and months to work closely with provinces and territories to increase significantly our rate of 3rd doses. Our rate of boosters in Canada is too low. It's lower than all other G7 countries, and that is not good. However, we know we can do better, and we have done really well with 2 doses over the last a year and a half, and that's what we're going to do also in the next weeks and months with all provinces and territories, so that we are better prepared and sufficiently prepared for what, as Minister Alghabra said, may be coming in the fall.
Okay. Now, I'm told that the ministers will be able to stay with us a few more minutes than originally forecast. And now, if I can get this right, Ryan Tumulty, National Post.
Yeah, I'm wondering, you just talked about the ineffectiveness of 2 doses versus the Omicron. Did you consider, as part of these discussions, creating a mandate for 3 doses instead of suspending the mandates?
We have considered all options, and we will keep considering all options as we keep protecting the health and safety of Canadians. That's what they ask of us. That's what we'll keep doing. And according to what public health experts have told us internally, and as you heard Dr. Tam say publicly on Friday, we now need to transition to an up-to-date status, which for most adults means a 3rd dose. There are approximately 60% of adults in Canada that have a 3rd dose. We need to move that up significantly, at least to what we have had for the last few months in terms of 2nd doses. About 90% of Canadians have had a 2nd dose, and that's a great outcome of which we can collectively be very proud. So it's a type of objectives and ambitions that we can set collectively. Dr. Tam has said just on Friday, that is needed now with the science that has evolved and with the epidemiology that is now making it possible today to make those announcements and prepare for a strong vaccination campaign with the full input and obviously collaboration of provinces and territories.
And Minister Alghabra, you've said today that you're going to keep ArriveCan and the vaccination requirement for international travels. We've heard from a lot of people that say that is one of the major bottlenecks at airports because the CBSA has to check vaccine credentials from all over the world in all sorts of different formats. Can you explain, given that it's a significant barrier, why you feel keeping that is so essential?
First of all, it is important to continue to require a proof of vaccination from international travelers. It is, again, vaccine, even a 2-dose vaccine, continues to protect against severity of illness. And in order for us to continue to protect the demands on our public healthcare system, we want to make sure that incoming travelers are at minimum vaccinated. Second, ArriveCan is a tool that public health and CBSA are utilizing to verify and ensure that incoming travelers have the proof of vaccination required. Third, are there ways for us to improve how the processes at airports to verify proof of vaccination? Absolutely. And as I stated earlier, we are working with airlines to ensure higher ArriveCan compliance by ensuring that airlines inform their passengers prior to boarding on the plane better. We looked at the data and we saw which airlines needed more help to ensure the better compliance, and we're working with those airlines. We're working with airports to ensure that there's better compliance once the passenger arrives. We're working with CBSA to minimize the number of questions that are duplicative, for example, and we don't have to ask these questions. So we're looking at, and we have implemented many measures to ease potential bottlenecks. But I want to close by saying this other point that I've said on many occasions. International airports are facing similar challenges. Heathrow's airport, Amsterdam airports, Dublin's airports, U.S. airports. This is a phenomenon that we're seeing because of the surge in demand and the labor is trying to catch up to that surge. And we're not saying that to accept the current situation. We're acting. We have a responsibility to act. We're working with airlines, we're working with airports, and we're doing everything we can to ease those bottlenecks.
Valérie Gamache, Radio-Canada.
Bonjour, M. Duclos. Je veux juste clarifier. Donc, vous dites que 2 doses, ce n'est pas suffisant. On veut encourager de travailler avec les provinces pour arriver à 3 doses. Est-ce que s'il y a un retour à l'obligation vaccinale, ce sera une obligation à 3 doses à l'automne?
Comme je le disais en anglais, toutes les mesures sont envisagées et envisageables parce qu'on ne sait pas ce qui nous attend pour l'automne et on va être préparé à tout. On sait que 2 choses, que la COVID-19 va être avec nous à l'automne. Et on sait qu'elle pourrait être avec nous avec d'autres variants que le variant Omicron. Et que peu importe que ce soit le variant Omicron ou d'autres variants, la meilleure façon de se protéger, c'est d'avoir une vaccination à jour. Une vaccination à jour, pour la grande majorité des Québécois, c'est une vaccination à 3 doses. Pour certains Québécois, c'est une vaccination à 4 doses. Mais on insiste sur la 3 doses parce que tous les adultes au Québec sont maintenant admissibles à une vaccination à 3 doses. Évidemment, en respectant les consignes de la santé publique qui demandent aux gens d'attendre quelques mois après une deuxième dose. Donc, ceci étant dit, avec ce que la Dr Tam a dit vendredi dernier, il ne serait pas possible de retourner à un mandat de 2 doses. Donc, c'était d'autres mandats, d'autres mesures de santé publique, des mesures de quarantaine, des mesures de tests. Ce seraient des mesures qui auraient besoin de reposer à partir de maintenant sur une définition de vaccination à jour.
Et M. Leblanc, vous avez parlé tout à l'heure en disant que les gens vont revenir dans les aéroports, les travailleurs, et ça va faire en sorte qu'éventuellement le trafic va reprendre. Je dirais, les activités vont reprendre, mais ça ne se fera pas du jour au lendemain rapidement. Est-ce que vous avez l'impression que tout ça arrive un peu trop tard pour sauver la saison touristique?
Too late in the game to save this year's tourist season?
Moi, je ne pense pas. Et comme on a dit clairement, les mesures ici, la suspension des mandats en ce qui a trait à la vaccination, n'ont rien à faire avec la congestion et les retards que nous voyons aux aéroports. Cette situation-là est causée par une série de facteurs, la pénurie de main-d'œuvre à travers tous les acteurs économiques à l'intérieur et à l'extérieur de nos aéroports. Nous avons pris les mesures aujourd'hui basées sur l'avis scientifique, l'évolution, comme M. Duclos a dit, du virus et les meilleurs outils nécessaires pour protéger les Canadiens. On a d'autres façons de travailler avec les compagnies aériennes et d'autres afin d'alléger la congestion et les difficultés que nous voyons aux aéroports. M. Alghabra a bien dit, c'est un phénomène qu'on voit à travers le monde, à d'autres aéroports internationaux qui n'ont peut-être pas la même posture que nous avons au Canada en termes de mandat de vaccin. Et nous allons maintenir, comme il se doit, les mesures pour les voyageurs internationaux qui arrivent au Canada. Alors, moi, je ne veux pas prétendre que nous prenons des mesures ou nous annonçons des mesures aujourd'hui visées sur des questions touristiques ou aux aéroports. Comme depuis le début, les décisions que nous prenons aujourd'hui sont basées sur la meilleure façon que nous croyons nous pouvons agir pour protéger les Canadiens et nous ne ferons jamais des excuses pour avoir une approche prudente qui prend en considération notre devoir solennel d'avoir en place les mesures nécessaires pour protéger les Canadiens.
Donna McCharles, Toronto Star.
Hi. Mr. Alghabra, I'm not sure I understand, though, you've talked about the work you've done till now, working to ease chaos at airports, but you're essentially allowing about 7 million more Canadians and their families to travel now. So what exactly is the federal government doing to ease the potential lineups and chaos that could cause?
So, Tanya, first of all, we'd be happy to provide you with data over the last 2 weeks and how we are seeing significant improvements over the last 2 weeks of the flow of passengers, either outbound or inbound. And including inbound, there's at least 40% reduction of hold from this week compared to last week. Having said that, let me go through some of the measures that we've been doing to ease some of the congestions that we're witnessing at airports. We've hired 900, today, by the way, the number is almost 900 CATSA staff, and that's in a span of a few weeks. If you understand labor shortages that we're facing today, you know what a big feat that's been. 900 workers, CATSA has have been added to our staff, and now we're seeing a lot of improvement as well as outbound travels. We are streamlining arrivals processes. So I talked about ArriveCan. We're increasing compliance. We're increasing kiosks at CBSA. CBSA is also hiring a lot of summer students. So there's a lot more resources right now available and improved processes for receiving international travelers. There's daily meetings, particularly at Pearson Airport, that brings together CBSA, Transport Canada, CATSA, Public Health, and airlines, where they're discussing every day the current schedules, the current potential bottlenecks, and taking action on the spot to ease these pressures. So I want to say that it is, yes, it is an international phenomenon, but our government is acting urgently, swiftly, and decisively to provide the support to airlines, to airports. We are now calling as well on airports and airlines to do everything they can to continue to work with us on ensuring that we smooth in these potential bottlenecks. So there's been a lot of measures, and we're seeing, through data, we're seeing improvements over the last few weeks.
Minister Duclos, can you tell me when exactly did Dr. Tam and the Public Health Agency first advise you that the government could relax these restrictions? And since you've said that the third dose, basically being 2-dosed, is not enough, third dose is, the decision not to change that formal definition of what it is to be fully vaccinated, I'm not sure I understand why you don't actually change that now as opposed to wait until the fall or some other time.
Okay, let me be, I should let Dr. Tam obviously speak for herself, but Dr. Tam didn't advise us to drop a particular measure in particular, as openly. she said on Friday, she said that 2 doses don't work anymore when it comes to protecting against infection and transmission. Doesn't work enough. Obviously, it's better than 0 dose, but not enough compared to what a Delta situation would have generated. And she also pointed to the fact that the issue is the waning immunity. If you get the 2 dose, the second dose now, you'll be protected the range of between 40 and 80% against infection, plus an additional protection against transmission. But that wanes over time. So after 6 to 7 months, it's around 20% or lower when it comes to protection against infection and transmission, and that's not enough. However, what she also said on Friday, and she has mentioned that a couple of times earlier, that if you get a 3rd dose, then that jumps up back to between 40 and 80% again. It also increases your protection against severe disease, which is also a key indicator, because with a 2 dose, after a few months, unfortunately, your protection against severe disease falls to approximately 60 to 70%. But if you get a 3rd dose, it goes up to 90%, which is a big impact. It effectively reduces by 2/3 your risk of being hospitalized when you have a 3rd dose as opposed to a 2nd dose. So she said all of those things very clearly on Friday, but she had mentioned those things earlier as well. And obviously, she communicated those facts with us over time. Now, we are meeting very regularly, at least once a week. I do that obviously more often than that, to get the latest scientific evidence from her team and from experts outside of the government. Why wait to do that?
To change the definition.
Why wait
the question was, since you're saying 3rd doses are the be-all, end-all right now, or at least the current answer, but you're not changing any definitions around what it means to be fully vaxxed. So I'm not understanding the coherence.
So what is clear now, and what public health experts, including outside of the government, have been saying for some time, and that's also true for many of them outside of Canada. I may come back to that in a moment. I don't want to spend too much time. But what has been said for many weeks and months, if you read through the media and expert reports, you'll see that it's been increasingly clear that the government of Canada should state clearly that an appropriate understanding of vaccination must be up-to-date vaccination. People should be up-to-date vaccinated. Fully vaccinated, according to health experts, including to Dr. Tamin Pihak, that's not strong enough now. So we need to transition to a new phase of fighting COVID-19 that comes with the strong recommendation that NACI made some weeks ago already, that people should be up to date in their vaccination status.
Okay, Abigail Binman, Global.
Minister Alghabra, your government has been consistently vague about specific benchmarks that would be needed to reach today's decision. I've heard a number of answers that give some general indicators, but I'm wondering what specific benchmarks got you here, and again, what benchmarks could we see in the fall that would cause you to bring these mandates back?
We've been clear about the benchmarks that got us to this point. First and foremost, the current situation, COVID situation at home. We are seeing improvement at our public health care system. We're seeing declining of COVID rates, and we have one of the highest vaccination rates in the world. We have data now that says a 2-dose is not doing given Omicron, is not doing what it did last fall. So there's been several indicators that we've relied on to get to this decision. And these indicators were examined in our conversations about what the next steps are. So these indicators informed our discussions, but we needed to look at what next. So given these indicators, what is our policy moving forward? What is our approach moving forward? And that's why we are offering now a comprehensive plan. Yes, we're adjusting our measures based as we have done in the past. I can go through a list of measures, by the way, that we've lifted over the last months, whether it's pre-departure tests, whether it's upon arrival tests, whether it's hotel quarantine, whether it's all kinds of other measures that have been lifted or adjusted, and we're doing today the same thing. We're adjusting based on improving or changing circumstances, but we are offering a vision to comfort Canadians that we will continue to be vigilant. If circumstances change, we will react and we will be proactive in ensuring that we continue to protect the health and safety of Canadians.
But your point about offering a vision to comfort Canadians is sort of exactly what I'm talking about here. You're talking about lower cases, but is it X% of hospital beds that aren't full? You talk about high vaccination rates. That needle hasn't really moved recently. Is it a specific point? Like, what can Canadians take as a hard statistic that helps them understand why they're gone today, not last month, and when they may come back?
Again, I'll ask Minister Duclos to add his own comments, but I'll tell you, while we're always looking for quantitative benchmarks, and quantitative benchmarks are helpful, but there are also qualitative benchmarks that we look at, including risk and risk factors. So those risk factors are a qualitative assessment based on the current situation, not only of the nature of the virus, not only on the nature of the transmission of the virus, but also what other risks are we contemplating. That's why it's very hard to just give hard quantitative benchmarks without leaving room for a qualitative assessment of the current situation. And we know that the current situation is going to change, hopefully to the better, but we need to be prepared if it changes to the worse. And yes, all of these factors, Abigail, you mentioned, are part of these examinations, but there are other risk factors that we have to take into account in cooperation and discussions with our partners at the provinces and the territories.
And perhaps, just if I can add something, Abigail, I think what my colleagues have said and what we've said from the beginning is that we have deliberately and consciously chosen to take a cautious approach. Some other people have advocated more reckless courses of action. Some people are looking for those magic numbers, as Omar said, where all of a sudden it goes away. But as Jean-Yves said, there are also some stark numbers that tell us that COVID has not gone away. So we are, as a national government, I talk to provincial and territorial governments all the time. Jean-Yves Duclos has meetings with his colleagues across the country. We're constantly evaluating our posture and seeing what we can do to ensure the best series of measures to protect Canadians. And as Omar said, they have evolved over time as the virus has evolved. So today is simply a continuation of a measured, cautious approach that we hope will allow Canadians, as the nice weather comes, as the summer months come, to perhaps be in a different posture. But we're not naive about what might happen in the fall. We hope very much that that is not the reality. But as we've said, if we get to a different circumstance in the fall or this winter, we will again not hesitate to take our responsibilities and to put in place a series of measures necessary to protect Canadians. And I think that's a fundamental difference from some of our political adversaries, and I think it's a fundamental difference that Canadians have come to respect and appreciate.
Okay, we've got about 3 minutes left and 4 people left on the list, unless the ministers are able to stay a couple minutes later. Mia Rabson, Canadian Press.
So you've said repeatedly that science was what was informing your decisions, but you have 6 months ago, the science said that 2 doses wasn't enough. 6 months ago, the science said that the vaccines that we had were not preventing infection. Why did it take 6 months for your government to move on vaccine mandates?
Well, let me say 2 things. A, we've been very successful until now, and I think it's important for Canadians to be proud of what they've done. B, we know, and we've been told by Dr. Tam and many other experts, that we need to transition. And that's what we're doing. We're transitioning because we want to continue being successful. And to continue being successful means that we need to transition to a 3rd dose / up-to-date vaccination status for most Canadians. And that's what we're going to do in the next few weeks and months as we work with provinces and territories, because obviously they have many more levers to work with than we do at the federal level.
That doesn't answer the question, though, as to why it took 6 months when the science told you 6 months ago that the 2 doses wasn't enough. And many of your opponents have accused you of playing politics with this rather than science. You have not put the science on the table. What science has changed in the last few weeks that's different than what we knew in December that made you decide that now is the time to change this?
Well, one thing hasn't changed and one thing is changing. The thing that hasn't changed is what experts have told us for many weeks now, is that, and what Canadians understand, and most of them understand and have followed their advice, is that we need 3 doses to protect against infection, transmission, severe disease, long COVID, hospitalization, and death. What is changing now is our focus in the next few weeks and months to increase our rate of collective protection against COVID-19 through a significant effort in vaccinating Canadians with more boosters. So we will do that because we know the summertime is a season where, as Minister Leblanc said, now there will be a warmer temperature. If we listen to experts and base our understanding on what we've seen in the last 2 years, there will be lower cases, fewer hospitalizations. That's the right time for Canadians to not only to pause and deserve a summer of break, but also to think of how to better be prepared individually and collectively for the fall season.
But again, people are always looking for a magic date and a magic number. And if COVID has taught us one thing, there is no magic date where everything's suddenly resolved and every public health measure can disappear. And as my colleagues have said, the numbers that we're focused on are the numbers of Canadians that are in hospital today, including intensive care units, with COVID-19, and the number of people who've tragically died in Canada and around the world because of COVID. So if our political adversaries say that there's some political circumstance, I think, frankly, that would be the height of hypocrisy when our government has been prepared to take the difficult decisions, including taking the time necessary to arrive at the right cautious approach. We haven't been reckless, as some of our political adversaries have, in terms of making up scientific evidence or pointing to a whole series of factors that they say offers simplistic solutions. We have, as a government, and Omar said it very well, deliberately taken the time necessary to arrive at the right place based on the best medical and scientific advice that we can have in Canada and from partners around the world. And that's exactly what we're going to continue to do. So we've done it for over 2 years since COVID began, and we're going to continue to do it. So people shouldn't be surprised by that, and people shouldn't be surprised that we're not taking knee-jerk positions simply because some political adversary pretends there's a magic solution.
Okay, we're at the time that we were given. There are 3 people still on the list. Is there any possibility that you might be able to take 1 or 2 more questions, maybe 3?
Cancel the question period.
We're a lot less rowdy. Okay. Well, thank you very much. And this ends this press conference.